Today we're diving into the world of kidney function tests, focusing on two key markers, creatinine and eGFR. These tests are vital for understanding how well your kidneys are working. Whether you're curious about your own health or supporting someone else, knowing what these numbers mean can make a big difference. Let's start by exploring why kidney health matters and how these tests fit into the bigger picture of your overall well-being. Your kidneys play a crucial role in filtering waste and excess fluids from your blood. They also help regulate blood pressure, balance electrolytes, and produce hormones. When kidneys aren't working properly, waste can build up, leading to serious health problems. That's why regular kidney function tests are so important, especially if you have risk factors like diabetes or high blood pressure. Creatinine is a waste product produced by muscles during normal activity. Your kidneys filter creatinine out of the blood, so measuring its level gives doctors clues about kidney function. High creatinine levels can signal that your kidneys aren't filtering as well as they should, but what's considered normal? Let's break it down in the next scene. For most adults, normal blood creatinine levels range from about 0.6 to 1.3 milligrams per deciliter. However, these values can vary depending on age, gender, muscle mass, and even diet. For example, people with more muscle may naturally have higher creatinine levels. It's important to interpret results in the context of your overall health and medical history. eGFR stands for estimated glomerular filtration rate. It's a calculation based on your creatinine level, age, sex, and sometimes race. The eGFR gives a more complete picture of kidney function by estimating how much blood your kidneys filter each minute. This number helps doctors stage kidney disease and monitor changes over time. eGFR is calculated using a formula that includes your blood creatinine level, age, sex, and sometimes race. This formula helps adjust for differences in muscle mass and other factors, making the result more accurate for each individual. The higher your eGFR, the better your kidneys are filtering waste from your blood. Normal eGFR is typically 90 or above, indicating healthy kidney function. Values between 60 and 89 may still be considered normal for some people, especially older adults, but can also signal early kidney issues. An eGFR below 60 for 3 months or more usually indicates chronic kidney disease. Creatinine and eGFR work together to give a fuller picture of kidney health. While creatinine shows how much waste is in your blood, eGFR estimates how well your kidneys are filtering. Doctors use both results to diagnose problems, track changes, and decide on treatment plans. This combination helps catch kidney issues early, even before symptoms appear. High creatinine levels can be caused by a variety of factors. These include dehydration, certain medications, intense exercise, or underlying kidney disease. Sometimes, temporary increases happen after eating a lot of meat or taking supplements. Persistent high levels, however, usually point to kidney problems that need further investigation. Low creatinine levels are less common and often not a cause for concern. They can occur in people with low muscle mass, such as the elderly or those with certain chronic illnesses. Sometimes, pregnancy or severe weight loss can also lower creatinine. Doctors consider the whole clinical picture before making any conclusions. Low eGFR means your kidneys are not filtering blood as well as they should. This can be a sign of chronic kidney disease, especially if the low value persists over time. Early detection is key, as managing underlying causes can slow or even prevent further damage. Your doctor will look at trends and other test results to make a diagnosis. Often kidney problems develop silently with no obvious symptoms in the early stages. As kidney function declines, symptoms like fatigue, swelling in the legs, changes in urination, or high blood pressure may appear. That's why routine testing is so important, especially if you're at higher risk. People with diabetes, high blood pressure, heart disease, or a family history of kidney problems should have regular kidney function tests. Older adults and those taking certain medications may also need monitoring. Early testing can catch issues before they become serious, allowing for timely treatment and lifestyle changes. Preparing for a kidney function test is usually simple. You may be asked to avoid certain foods or medications before the test. It's important to follow your doctor's instructions to ensure accurate results. Staying hydrated and informing your healthcare provider about any supplements or recent illnesses can also help. Kidney function test is typically a simple blood draw. The sample is sent to a lab where creatinine levels are measured and eGFR is calculated. Results are usually available within a few days. Your healthcare provider will review the results with you and discuss any next steps if needed. Interpreting kidney function test results isn't always straightforward. Factors like age, sex, muscle mass, and overall health all play a role. That's why it's important to discuss your results with a healthcare professional who can put the numbers in context and recommend any follow-up steps. If your creatinine or eGFR results are outside the normal range, don't panic. Many factors can cause temporary changes. Your doctor may repeat the test, order additional labs, or recommend lifestyle changes. The goal is to identify any underlying issues early and take steps to protect your kidney health. Chronic kidney disease, or CKD, is divided into 5 stages based on eGFR values. Stage 1 is mild with eGFR above 90, while Stage 5 is severe with eGFR below 15. Knowing your stage helps guide treatment and monitoring. early intervention can slow progression and improve quality of life. In stages 1 and 2 of chronic kidney disease, eGFR is still relatively high and symptoms may be minimal or absent. At this point, the focus is on identifying and managing risk factors such as controlling blood pressure and blood sugar to prevent further damage. Stage 3 CKD is when eGFR drops between 30 and 59. At this stage, some symptoms may appear such as fatigue or swelling. Regular monitoring and medical management become even more important to slow progression and address complications. In stage 4, eGFR falls between 15 and 29. Symptoms are more likely and complications such as anemia or bone disease may develop. At this point, preparing for possible dialysis or transplant is important, along with managing symptoms and complications. Stage 5 CKD, also known as end-stage renal disease, occurs when eGFR drops below 15. At this point, the kidneys can no longer filter waste effectively, and dialysis or a kidney transplant is usually needed. Early planning and support are essential for managing this stage. Not all kidney problems are chronic. Acute kidney injury, or AKI, is a sudden loss of kidney function, often due to illness, injury, or certain medications. AKI can sometimes be reversed with prompt treatment, so recognizing the signs and seeking care quickly is important. Managing kidney health involves more than just monitoring test results. Healthy lifestyle choices such as eating a balanced diet, staying active, and avoiding excessive salt or processed foods can help protect your kidneys. Regular checkups and following your doctor's advice are key steps. Some medications can affect kidney function, especially if taken in high doses or for long periods. Always let your healthcare provider know about all the medicines and supplements you're taking. They can help you avoid drugs that may harm your kidneys or adjust dosages as needed. Kidney-friendly diet is low in sodium, processed foods, and sometimes protein or potassium depending on your condition. Eating plenty of fruits, vegetables, and whole grains supports overall health. Your doctor or a dietitian can help you create a plan that's right for you. Staying well hydrated helps your kidneys filter waste efficiently. However, if you have kidney disease, your doctor may recommend limiting fluids to prevent swelling or other complications. Always follow your healthcare provider's advice about how much water to drink. Regular exercise supports kidney health by helping control blood pressure, blood sugar, and weight. Activities like walking, swimming, or cycling are great choices. Always check with your doctor before starting a new exercise routine, especially if you have kidney disease. High blood pressure is a leading cause of kidney damage. Managing your blood pressure through medication, diet, and lifestyle changes can protect your kidneys and slow disease progression. Regular monitoring is essential for those at risk. Diabetes is another major risk factor for kidney disease. Keeping your blood sugar in a healthy range helps prevent kidney damage. Work with your healthcare team to monitor your levels and make adjustments as needed. Protecting your kidneys means avoiding injuries and infections. Stay up to date with vaccinations, practice good hygiene, and avoid exposure to toxins or heavy metals. If you have a urinary tract infection, seek treatment promptly to prevent complications. Kidney function can change over time, so regular monitoring is important, especially for those at risk. Your doctor may recommend periodic blood tests to track creatinine and eGFR. Watching trends helps catch problems early and adjust treatment as needed. If your kidney function is declining or you have complex health needs, your doctor may refer you to a nephrologist, a kidney specialist. These experts can provide advanced care, recommend further tests, and help manage complications. Kidney function tests are also important for children, especially those with risk factors or symptoms. Normal values for creatinine and eGFR differ in children, so pediatricians use age-specific reference ranges. Early detection and treatment are key for lifelong kidney health. Pregnancy can affect kidney function, so regular monitoring is important for expectant mothers, especially those with pre-existing kidney issues. Your doctor will interpret test results with pregnancy in mind and adjust care as needed to protect both mother and baby. Kidney function naturally declines with age, so lower eGFR values may be normal for older adults. However, it's still important to monitor for signs of disease and manage risk factors. Your doctor will help determine what's normal for you. Some people inherit a higher risk for kidney disease. If you have a family history of kidney problems, regular testing and healthy habits are especially important. Genetic counseling may also be helpful for understanding your risk. Lab reports can be confusing with lots of numbers and abbreviations. Focus on the creatinine and eGFR values and ask your doctor to explain anything you don't understand. Over time, you'll become more comfortable interpreting your results. Keeping a record of your kidney function test results can help you and your doctor spot trends and make informed decisions. Many people use health apps or simple notebooks to track changes over time. Consistent monitoring is a powerful tool for managing your health. Learning about kidney problems can be stressful. It's normal to feel anxious or overwhelmed by test results or new diagnoses. Support from family, friends, and healthcare professionals can make a big difference. Remember, you're not alone on this journey. There are many resources available for people with kidney disease, including support groups, educational materials, and counseling services. Connecting with others who understand your experience can provide comfort and practical advice. When discussing kidney function test results, it's helpful to prepare questions in advance. Ask about what your numbers mean, how often you should be tested, and what steps you can take to protect your kidneys. Open communication leads to better care. There are many myths about kidney function tests. For example, some people think only older adults need testing, or that abnormal results always mean serious disease. In reality, anyone can benefit from testing, and many issues are manageable with early intervention. To sum up, kidney function tests like creatinine and eGFR are essential tools for monitoring your health. They help detect problems early, guide treatment, and support long-term well-being. Understanding your results empowers you to take charge of your kidney health. Remember, regular kidney function testing is a simple but powerful way to protect your health. Stay informed, follow your doctor's advice, and make healthy choices every day. Your kidneys work hard for you, take care of them in return.